Hello, and welcome to our third annual Pause Conference. Obviously, due to the pandemic, we had to cancel our face to face conference, but we are super excited to bring you the same content via our social media and virtual platforms. This year's conference is titled Search, Expose, Heal. And the goal is to help everyone that takes part in this conference begin, restart, redirect, or move forward in their healing journey. We recognize that some of our content, the stories shared by our speakers, and the guidance from our professionals and spiritual leaders might be triggering for some of our audience, but also might be inappropriate for younger, less mature viewers. So please be responsible in your viewing of our content. We also want to reiterate that any content shared within the conference or on the Pause Wellness blog, social media platforms, or website is not a substitute for professional help. We want to encourage you all to seek your own help from a professional who can tailor your guidance and your advice to your specific need. Hello, and welcome to day 2 of our first week of Search, Expose, Heal. Yesterday's keynote speaker, Stacey Colbreth, shared her triumph over childhood trauma and revealed the obstacles that hindered her progress, as well as the tools and motivating factors that propelled her forward. Today, you will hear from Janae Tidwell of Fowler and Tidwell Counseling. She's going to share great advice about navigating through the effects of trauma and what to keep in mind when choosing a support team. At Pause, we talk a lot about doing some of the work on your own and this being an all-encompassing process of healing yourself spiritually, mentally, and physically. It is very important that you seek a mental health professional, as we stated in our disclaimer a few moments ago. This is not a substitute for professional help. You need someone that is going to be able to help you navigate your specific needs and give you guidance tailored to your specific situation. So we encourage you, after watching this video, take her tips in mind, take them to heart, and choose someone that fits you and your needs in this process. Remember to like, comment, share, ask questions. We'll address all of these in the Thursday night live session at 7 p.m. Again, thank you for viewing, and we look forward to hearing from you. See you again shortly.
Hello, everyone. My name is Janae Tidwell, and I'm a licensed professional counselor here in the Houston area. I just want to thank Devin for the opportunity to be a part of this Pause conference and give my reflections and thoughts on all the people who are giving their testimonials and their input as far as their experiences with trauma. First, I just want to thank everyone, and I'll do this every segment, thank everyone for being so vulnerable and open about what they've been through and how their lives have been affected by trauma, but most importantly, how they are working to heal from their trauma. So just a few thoughts in regards to the testimony that has been given today that you guys have maybe already seen. First up, I would definitely say it's so important that if you have experienced some trauma and you're looking to go through a healing process, that you've got a support system around you, not just whomever your professional therapist is, but a support system that is outside of that, friends, family, whoever that may be. You're going to need that person to lean on and continue to kind of push you in the therapeutic healing process. It is not easy to go through healing. If you think about healings that happen with broken bones or with other diseases, they always say it's good to have a support system there throughout that process. There's a team of people who may help you and make you get back to whole. And so you're going to need the same thing when it comes to therapeutic healing from trauma. You need a team. So definitely make sure you've got those people beside you. The second thing I would note is make sure you shop around for the right therapist. We are definitely not one size fits all. You know, I say as a African American woman, there's a few people that I shop around for that I have to be sure I'm comfortable with when I sit down for their services. I have to be comfortable with my beautician. I have to be comfortable with my OBGYN, and I have to be comfortable with my therapist. If I'm not comfortable in any of those places, it's time for me to move. So make sure you shop around and find the right fit for you to work through your trauma and get to that place of healing. That relationship is so vital and so important that you need to really connect and really feel like it's a really good fit. And again, we're not one size fits all. So, how one person may approach the therapeutic process of healing your trauma may be different from another. And so, just like you may have different ways in which to attack an illness, you may have different medications prescribed for diabetes or high blood pressure. You can have different therapeutic standpoints utilized to heal the same type of trauma. But you've got to find the therapist and the techniques and theory base that work for you. So, please take the time to truly shop around. The third thing I would mention, and this is something that is definitely big in the African American community, realize that therapists are not pastors and pastors are not therapists. We have both a place in the client's life, right? They can both be a part of that healing team, but we are not there to do the same things. And so I know many clergy, pastors that say, bishops, whomever, who say, we thank God for therapists because we may have had a short time in their training where they got some pastoral counseling classes and techniques and education in regards to that, but that is nothing in comparison to the 2.5 or 3 years that we as licensed professional counselors had to go through. Our training is vastly different. Now, if you happen to come across a clergy member, a pastor, a therapist, or a bishop, or whomever, who also is a licensed professional counselor, maybe you've hit the jackpot for yourself, and there are a few of them out there. And they can really give you the best of both worlds. But I think it's unwise and also unrealistic for us to expect our pastors to be also a licensed therapist, or maybe your therapist to always bring in the spiritual component. So there may be two levels of healing that need to take place there. And the testimony that we just heard, she spoke directly to that. She had to go and get the professional help she needed from a licensed therapist, and then she had to go and get some spiritual help from the clergy members and the pastors, in her life that she was closest to. And again, even there, she had to find the right fit, because not everybody is going to understand exactly what to do and how to treat trauma the way that you need it. So just be mindful of that. That's so vastly important. The fourth note I want to say about healing trauma is be ready to do the work. This is not a situation where you're going to come in and the therapist is going to outline how we're going to make this happen for you, and then they're going to just magically make it happen. You're not going to sit down, be spoken to or be talked to, and think, okay, well, when I get up, I've got everything that I need and I'm going to feel better when I walk out of that office. There are some times where you may walk in and you may walk out feeling worse, because you've had to be vulnerable. You've had to think about things. You've had to address topics, issues, experiences that you may not have dealt with before. And so sometimes healing can be painful. If we think about resetting a broken bone or having a cavity filled, right? We know that we're going to maybe go through a painful process in order to truly get the healing and have things be the way that they were intended to be. Therapy is very similar in that regard. Usually I tell all my clients things are going to get worse before they get better, just because this is tough and you're going to do things and say things and maybe think about things that you have not thus far. And so really be ready to do the work when you walk in the door and you sit down with your therapist, because they truly are there to help you, and they want to see you get to a place where you don't need them per se anymore. If you stick around and you want to work on other things, or if you continue to go to treatment for what we call maintenance to kind of keep things okay for yourself, that's always our goal. Any therapist who you need to see for a lifetime, you need to fire, because they're not progressing you forward. You should actually get to a place where you feel like, hey, I did the work and I'm there. Now, life does happen. And you may face new issues, you may face new challenges, and you may need to go back and return and say, you know what, I had it together when it came to this, but now I'm dealing with that. And it's a whole new ball game, and I'm back at square one with some stuff. And that's okay. That's absolutely a great reason to return to treatment. But you should, one, you shouldn't be in treatment for a lifetime. And two, realize when you walk in, your therapist is thinking you're ready for healing and you're ready to do the work. And so they may push you a bit, but that's the whole point, is to get you to that place of healing. And then final thought, and I loved the testimony. I loved the lady who gave the testimony and her discussion of trust and how trust is such a vital part of the therapeutic healing process when it comes to trauma. Whenever there's a traumatic event for anyone that takes place, trust is always going to be affected. Whether I have to retrust a certain type of individual, whether I have to retrust family, whether I have to retrust my safety and security and being out in the world, I am dealing with trust in some type of way. And so really I appreciate her experience and her speaking to how she looked at her ability to regain trust with people, with situations, and with circumstances. And to build trust, I feel like you need to rebuild trust. You need a few things. You've got to have some transparency in what it is that has affected you and really what you've gone through. Being transparent about that and really coming to the table with all your cards spread out about what you have experienced is going to be vital in rebuilding your trust. Second part, you've got to be vulnerable. You can't learn to retrust again if your defenses are consistently and constantly up. There's no way to trust anything or anybody but yourself if you're not willing to be vulnerable and take a risk in regards to letting the guard down and letting somebody back in. But with that vulnerability, there's got to be discernment. You got to realize who it is that should have your trust and who shouldn't. And maybe there are some ways in which that you will grow trust in people. And that's something to discuss with those people who are close to you in your life, whether it is them being vulnerable with you and trusting you with something. And so you feel like both of you have an equal sacrifice. Or if it's this person is always showing up. They're always doing things for you. They're always there and helpful, and you can depend upon them. That may be your way of building trust and discerning that this person is trustworthy. Or if it is that you just listen to them. You hear what they're saying, and you say, you know what? I can hear the wisdom. I can hear that they have been through some things, and I can hear that this is a person that really maybe has my best interest in mind. And so I can discern that they are a person that I can trust. So discernment truly is important, but I think it's also important that you know what it is that allows you to say this person is trustworthy. And then the last piece to building trust or rebuilding trust is belief. You got to believe that you want to and you can trust again, because people can do 50 gazillion things under the sun. But if you never decide and believe that you're able to trust them again, there's no way you will. So you've got to have transparency, you got to have vulnerability, you got to have discernment, and you got to have belief. All of those things are necessary for the rebuilding of trust when it comes to experiencing and coming out of that place of trauma and getting to a place of healing. Thank you so much for taking some time. I really hope these few notes of reflection and thought helped and assisted you. If there's anything else that I may do to assist you further, you can contact me directly, Janae Tidwell, or you can contact Devin, who can connect you with myself and one of maybe my many therapists at the two practices I have. More than willing to definitely assist you in your process of healing and making sure you get from victim to survivor and then to thriver. We want everybody thriving. Take care.
Thank you, Janae, for your excellent insight into how to navigate through healing from trauma. I'm going to reiterate her 5 points just because I think these are the things that we need to pay close attention to. Number one, your support system outside of therapy. Your therapist is not going to be with you every day. Your therapist is not going to be someone you can call up on the phone at 2:30 in the morning because you're having a moment. So it's important that you have someone. Not saying you got to have a whole basketball team full of people, but if you have someone that you can share with, be vulnerable with, it's important to this process. Um, Shop around for your therapist. I think that there are some constraints to that, obviously, especially if you're going through insurance, but it's important that you find the best fit for you. And finding the best fit for you is important. But that includes, can I afford this? Because creating, and Janae actually shared this at our conference last year, creating a financial burden will only be detrimental to your process. Someone that's located near you or convenient to you being able to go consistently, but also just finding someone that is going to help you progress, someone that you're comfortable with, someone that you don't mind sharing with. Um, Something that I think we all have to remember, that pastors and therapists are not the same thing. Your pastor may not be equipped to help you handle the level of trauma you've been through. Yes, they can pray for you. Yes, they can give you scripture, but sometimes they can't reach you. I had a therapist tell me they could not reach me spiritually because mentally I was gone. So, and that's a scary thing to hear from someone that does that for a living. But it changed my perspective, and I focused on healing mentally before I made the priority becoming a spiritually whole, if that makes sense. I had to get my mind right, so to speak, before I could ever take the walk that I was trying to walk. Um, Being ready to do the work. Therapists are not magicians. They can't wave a magic wand. It doesn't happen after one session. It may not happen after 6 months, but it's about the level of work you're putting into it. How bad do you want to be healed? How much do you want to move forward? I can honestly say that I have had therapy sessions that, while the conversation felt light and we joked and we talked about situations candidly, I left heavy. I left in tears. I left not hurting, so to speak, but processing things that I had not allowed myself to process before. I've had revelations in therapy that I hadn't considered just in talking about day to day life, the epiphany of this is why this is happening, or this could be the reason why I'm experiencing what I'm dealing with right now. So it's important that you have to participate in this process. Like going to therapy, you're going to do most of the talking. They're going to ask questions. They may interject with an idea. They may redirect your conversation, but you have to do the talking. You have to open up. They're not going to tell you why you're there. They don't know why you're there. They know you signed up and got an appointment, you paid your copay, and you showed up. But most of the time, the first question is, so why did you need an appointment, especially that first meeting? You got to know why you need to go to therapy. And sometimes you can, this last time I just went and said, hey, a whole lot's happened and I don't know what to do. I feel like I need to be here because I might not make it if I don't. And that's okay. We have to be okay with that. We have to be willing to share with our therapist. They aren't going to commit you. They aren't going to put you in a quote unquote loony bin because you say, I'm having thoughts. I'm having thoughts that don't make sense. I'm having thoughts of harming myself. Am I at that place? No. I've had to say that out loud. Yeah, I've considered it, but no, I'm not at a place where I would do it. I've had to say, this is too much for me. This has been too much. This week was too much. I don't know how to navigate. Um, Sharing that with your therapist is important because they can't treat you for suicidal thoughts if they don't know you have them. That's a whole gamut of things that need to be addressed when you're having suicidal thoughts. So, the fear is that I go to a therapist and I tell them everything I'm thinking and they're going to commit me. They don't do that. They don't do that. They'll commit you if you harmed yourself, if you show up and you show evidence of harming yourself, if you make statements and things like that you might harm yourself or others, yes. But to say I'm having suicidal thoughts and I'm here because I want to get them taken care of, I want them resolved, I want to stop having them, is you saying I want to fix this before I get to the point. So I want you to be mindful of that as you consider going to a therapist. They're not all out to commit us and put us on medication and leave us to our own devices. I haven't been on medication since 2016, and I've had thoughts of going back on it, but I have a therapist that helps me navigate those times and helps me understand that I can't use the medication as a crutch, but if it's necessary, I need to get on it. So I think that's important. Knowing that you have to do the work and you have to be an active participant in your healing process and your therapy. One of the big things she touched on was trust. In finding a therapist, if you don't trust the person you're sitting with, you're never going to progress. In developing a support system, if you don't trust the people that are around you and trust that you can talk to them and tell them what's going on, you're never going to move forward in this process. Trust is so important. She laid a foundation for establishing trust, learning to trust again, building trust. And she said, and this is work that you have to do. This isn't the other person, this is you. These are decisions you have to make. These are things that you have to do in order to rebuild trust with another person, with your therapist, with life, and with yourself. Most of all, with yourself. Being transparent, being open, being honest, sharing, being vulnerable, allowing yourself to feel those things that hurt the most, and allowing the other person to see you feel those things that hurt the most. Be discerning, knowing when that person's not the one I should open up to, knowing when that therapist is not helping me progress, knowing that this situation is not right for me, it's toxic, it's not healthy, no matter what that situation is. Having a discerning mind, having discernment is something we often use when we're speaking spiritually, but it is very important mentally. Your discernment gets better as you learn to trust yourself. Believing you can trust again. So it's great to do all those things, but if at the same time, the person you're doing those things with, the environment you're in, the people you're doing that with, the therapist you're doing that with, if you don't trust them and you don't believe you can trust them, if deep down in your heart you feel, I can't trust this person, you're never going to build that trust. That belief is very important, just like with faith. So, again, I want to thank you, Janae, for offering such wonderful insight into healing from trauma. Tomorrow, we will be sharing videos of and reflections from our spiritual leaders. I'm excited about that because I think we'll have yet another interesting perspective. Following this, we will be moving into the event. So click on the event from Facebook. You should see the live chat. It'll just be me tonight, but I just want to make sure that I'm providing you every opportunity to share your questions, your comments, and your thoughts, because Thursday we will have a live video on the pause page, not in the event, but on the pause page with our keynote speaker, as well as potentially our spiritual leaders and our therapists, so that they can chime in and all the comments they'll respond to and things like that if they aren't able to be available. So I want to make sure that you are getting the most out of our virtual platform. And I look forward to seeing you in the live as well as tomorrow evening. Have a good night.